As human beings, most of us do experience anxiety and panic from time to time. However, if you're experiencing anxiety or panic regularly and it's having a significant impact on you, it's really important that you seek help, because there is help out there that can reduce the impact of anxiety and panic on your life. There are different forms of anxiety. For example, social anxiety, generalized anxiety disorder, and panic disorder. There are a variety of symptoms of anxiety. These include 4 main areas: our thinking patterns, our behavior, our emotions, and physical symptoms. And I'll just run through a few examples from each of these. Physical symptoms can include heart palpitations, shortness of breath, sweating, feeling really cold or feeling really warm. Thinking patterns: if we're feeling anxious, we might notice that we're very worried or concerned about what other people are thinking of us. Or we might notice that our thinking jumps to the worst case scenario. Our behaviour can often change when we feel anxious. We might feel that we want to avoid situations that make us feel afraid. We might start to reduce our social contacts. We might start to cancel our plans at last minute. Over time, if we're feeling very anxious regularly, we often reduce our comfort zone and reduce the number of people that we're coming into contact with and the number of new places that we're going to. And then fourthly, emotions. A common emotion people experience with anxiety is fear and dread. A panic attack is a very acute state where you develop sudden panic, fear, and anxiety. Common symptoms of a panic attack can include our heart racing, feeling like we might pass out, feeling extremely shaky, perhaps feeling nauseous, feeling like we have a headache, noticing tingling in our fingers or in our lips. The symptoms of a panic attack can last anywhere from 5 minutes to 30 minutes, and they can be very distressing and upsetting for us. They can often cause a fear that our physical health is at risk. However, it's important to remember that there are no risks to our physical health with a panic attack. In general, anxiety causes us to overestimate the dangers in life, whilst at the same time underestimating our ability to cope with these dangers or these situations that we face. And over time, the more anxiety takes hold of us, the more our comfort zone is reduced and the less able we feel to cope in situations where we feel anxious or nervous. Anxiety does not have to be in control of you. Through therapy, you can learn skills which can help you to cope with the symptoms of anxiety, reducing the impact it has on you over time, allowing you to lead a life which is fulfilling and free from fear. At the Edinburgh practice, we offer evidence-based psychological therapies for anxiety. One of the therapies with the most scientific backing is cognitive behavioural therapy, often referred to as CBT. CBT is an active and structured psychological therapy which involves thinking about those 4 main areas I referenced earlier: our thinking styles, our behaviour, so what we do, our emotions, and the physical symptoms. And the CBT theorises that these 4 areas are all interlinked. And with that interlinked cycle, often unhelpful thoughts and avoidance behaviours can lead us into distressing, vicious cycles that we want to break down and change through engaging in psychological therapy. CBT focuses on thought patterns, behaviours, and facilitating you, supporting you to develop effective and helpful ways of regulating your emotions. However, CBT is not just a talking therapy. As I mentioned, it's a very active therapy, which also involves you doing lots of work outside the therapy room. You will work with your clinician to develop exercises and experiments that you can test outside the therapy room to help you to overcome the anxiety or panic that you're experiencing in your life. This will always be done in collaboration with you, and we will work gradually, slowly over time to make you feel more confident towards tackling your anxiety. Therapy is usually once per week or once every fortnight, and appointments last up to 60 minutes. At the Edinburgh practice, we offer a multidisciplinary approach to mental health difficulties. This is no different for anxiety. Many of our clients can also benefit from psychiatry support. Our consultant psychiatrists at the Edinburgh practice can offer assessment and diagnosis of mental health disorders, including anxiety and panic disorder. They can also offer medication for clients where this is appropriate. For clients presenting with anxiety and panic, some clients will benefit from a psychiatry alone approach, including medication. Some clients will benefit from a psychology alone approach, benefiting from psychological therapy. And some clients will require both at once. And often this can change throughout a client's journey, with a client perhaps starting with medication and therapy, and then over time, perhaps reducing the need for medication as their therapy is progressing well in their life. All of our clinical decision making is based on thorough assessments at the Edinburgh practice, and we will always advise you of what we feel would be best for you at any point in time in your journey with us.